This is an in-depth look at the suicide rates within the veterans healthcare system. Specifically, we'll be talking about the problem, its background and causes, as well as looking at an organization and how its mission is affecting the suicide rates. Then we'll discuss a leader within the VA and the VA Mission Act and how it has helped the VA. Lastly, we'll talk about leadership traits that we've seen and possible improvements that can be made to the VA system.
Upon looking closer at the veteran healthcare system, one of the main problems that exist is the disparity of support and access to proper medication and mental health support services. So as a result of these issues, suicide rates have been skyrocketing. The suicide rates within veterans in the United States has shown an increase of more than 18% from the years 2011 to 2014. There is a lack of facilities and support groups that are available to assist veterans further and receive psychological services such as therapy and crisis intervention after deployment. Another one of the main issues regarding veterans and their access to healthcare is a lack of awareness of such facilities and services. Hester continues to add where a bill was passed for those coming back from deployment, where they'd be able to get full access to emergency health services such as temporary detention and therapy. And what this is made to do is to ensure full intervention and to prepare them before being reintroduced back to civilian life. And as a result of this bill, it was met with success, and what it shows is the need for these services to be widespread within the United States, for it only exists in Florida. Currently within the United States, the Affordable Care Act shows a lack of support for mental health services for low-wage earners, leaving out a percentage of veterans that are in need of this support. As a result of this, a lack of facilities and financial support affect more than 107,000 veterans who are homeless on any given night. Programs such as the Veterans Administration or the VA can aid in mental health screenings and early intervention for all service members before they are able to return back to civilian life.
The mental health of veterans and military personnel in connection to suicide dates back to World War I. Many veterans came back home fine, but many simply did not. Suicide rates began to increase at alarming rates, leaving the government not knowing what to do with the issue at hand. With the suicide rates rising, especially in New York, the government began to piece together trauma and mental illness to veterans committing suicide. Veterans were returning home with their mental states out of place with no help to seek. After World War II ended, the Servicemen Readjustment Act of 1944 was established. The act was made to provide veterans a range of benefits for their service. This act was a system for better support for veterans so that they would be able to return to civilian life again. With suicide rates being almost 2 times higher than the general population, it has led to a lot of speculation and scientific connections as to what is causing it. Some of the factors include substance abuse, mental health conditions including PTSD, insomnia, and psychosocial stressors. Veterans that abuse drugs and alcohol are twice as likely to commit suicide than veterans who do not. Aside from substance abuse among veterans, the mental health conditions and suicide have been linked together. The risk of suicide is significant in veterans who have symptoms or have been diagnosed with PTSD. It's believed that veterans who have intrusive memories or have combat-related guilt leads them to commit suicide.
In 2020, the United States passed the National Suicide Hotline Designation Act, which established a federal crisis hotline. Within that hotline, there is a specific line that service members and loved ones of service members can reach the Veterans Crisis Line, where they can receive free assistance in times of crisis. The organization is able to provide services through call, text, and online chat, and link them to people who can offer counseling and also local resources within the area. The organization, although known for suicide prevention, really has a broader mission scope that encompasses some of the potential causes that could lead to suicide and suicidal ideations.
Stephen L. Lieberman serves as the Deputy Undersecretary for Health, performing the delegable duties of the Undersecretary for Health. He leads the Veterans Health Administration, and he manages the largest integrated health system in the nation, which manages a budget of over $87 billion and oversees the care of 9 million veterans. Dr. Lieberman has around 25 years of experience as a board certified physician in pulmonary care, critical care, and also spinal cord injury. He has served as an associate chief of staff and deputy chief of staff at the Veterans Boston Healthcare System, as chief of staff at Veterans New Jersey Healthcare System, and he served as chief of staff for 2 veterans federal medical station missions following Hurricanes Rita and Gustave. Dr. Lieberman's practice and education have allowed for him to showcase his expertise in practicing good ethics, team management, and adapting with technological changes such as the electronic medical records in the veterans' healthcare. One of the biggest developments in the Veterans Health Administration was the VA Missions Act. The VA wanted to come up with a better program to help veterans. So veterans would now be eligible to receive care in communities if their VA facility was unable to provide them with services. If the veteran was unable to be seen for a primary care appointment or a mental health appointment, they had less than 20 days to be seen and within less of a 30-minute travel time. And if they needed a specialty care appointment, they would need to be seen within less than 28 days or a 60-minute radius of travel time. A few obstacles that the Veterans Health Administration deals with is physician and staff disengagement, and that leads to a huge problem with patient dissatisfaction. Since the Mission Act was signed in, the VA hospital patient treatment centers dropped 30% for in-person appointments. In September of 2020, the Americans for Prosperity Foundation filed a lawsuit against the VA on July 20th, 2021. They implied that the VA was using improper wait time calculations to bring patient care back to their own clinics. A member of the House Committee on Veterans Affairs stated that the VA is not following the law and holding veterans hostage to a healthcare system that is not serving them.
It seems that the issue of long wait times is the main problem within the VA system. We think that delegating responsibilities to lower-level managerial staff can simplify the structure of the VA and its care. We also think that having reasonable expectations for staff and the volume of patients can help with interpersonal relationships between the staffs and patients.